Welcome to the first health update of the year. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the recent spread of norovirus in South Florida. Dr. Raja, what is norovirus?
Norovirus is a highly contagious virus that infects the gastrointestinal tract of human beings.
What are the symptoms of this virus?
So the basic symptoms, because it's a gastrointestinal virus, are things like diarrhea, vomiting, nausea, and along with that, the usual problems that viruses cause, such as sometimes fever and headache.
How does it differ from coronavirus?
That's a great question. So the two viruses are actually very different. Coronavirus, SARS-CoV-2, for example, belongs to the group coronavirus. Those viruses infect the respiratory tract of human beings. Norovirus infects the gastrointestinal tract, so basically the intestine gut region. They belong to different families. They're also spread differently because they're infecting different regions of the body. So coronaviruses you spread when people who have it sneeze or cough or sometimes even talk. But norovirus, because it infects the gastrointestinal tract, it spreads through fecal matter, unfortunately.
So how can you prevent the spread of this disease?
So the best way to prevent spread of norovirus is just to keep things clean. So wash your hands very well. If we're eating food, wash our fruits very well, cook our food. All these things will ensure that we don't move the virus around from one person to the other.
How do treatments for coronavirus and norovirus differ?
So for norovirus, there is no treatment, unfortunately. The only thing you can do is really keep a hygienic environment, wash everything well, including your hands. For coronaviruses, also, we don't necessarily have a lot of treatments, but the big advantage or the difference here between norovirus and coronaviruses, there are vaccines available, and we can protect ourselves utilizing those vaccines. But for noroviruses, we don't have any such option.
So what should students do if they do get norovirus?
Good question. So unfortunately, there are limited things you can do. The good thing is that an average healthy individual, if you get norovirus, you will get better in about 2 to 3 days. Again, unlike coronavirus, it might take you a week, 10 days to get better with coronavirus. But with norovirus, you can get better in 1 or 2 days. So really all you can do is take good rest. Again, cleanliness, rest, and another big plus is drink lots of fluids. Drink lots of water to kind of basically flush the system and get rid of the microorganism that way.
Any last thoughts?
The basic things, again, keeping your environment clean. And I know this washing hands, people sometimes forget about it. When coronavirus first came out, we were all very particular. You know, we would sing particular songs, wait till the entire song was done while we were washing our hands. Maybe it is kind of time to go back to that. Wash your hands, warm water, soap, keep that practice going, and you should be pretty safe and you should be able to avoid the virus.
Thank you, Dr. Raja.
Thank you, Madison.
This has been Mako Media Health Update. I'm Madison Kasper. See you next time.